Imagine leaning in to speak and suddenly pulling back, not because of what you were about to say, but because you worried about how your breath might smell. Bad breath has a quiet way of stealing confidence. It can make people cover their mouths when they talk, step back during conversations, or avoid social moments altogether. And the hardest part is this: most of the time, you're the last person to notice it. Today, we're going to talk openly and honestly about bad breath, also called halitosis, what causes it, how to treat it at home, when it's normal, and when your body might be asking for help. Because bad breath is common, it's usually fixable, and it does not define you. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, Medicine Specialist, Diabetes and Hormone Specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. Now, let's start with the basics. Bad breath, or halitosis, simply means an unpleasant smell coming from your breath that other people may notice when you speak or breathe out. It's incredibly common. In fact, studies suggest that up to half of adults experience bad breath at some point in their lives. And here's something important to understand. Bad breath is not always a disease. Sometimes it's completely normal. For example, that strong morning breath when you wake up. Your mouth produces less saliva during sleep, allowing bacteria to grow overnight. Smoking, alcohol, fasting, crash dieting, or eating foods like garlic, onions, spices, cabbage, or sprouts can all cause temporary bad breath. In these cases, the smell usually improves with eating, drinking water, and good oral hygiene. But sometimes, bad breath sticks around. And that's when we call it pathological halitosis, meaning there is an underlying cause. In most people, the source is the mouth itself. Problems with teeth and gums are the #1 cause. Gum disease, cavities, infections, plaque buildup, or food particles trapped between teeth can all produce foul-smelling sulfur compounds. Bacteria sitting on the tongue, especially the back of the tongue, are another major contributor. Sometimes the smell comes from deeper areas. Tonsillitis, tonsil stones, sinus infections, acid reflux, or a very dry mouth can all lead to persistent bad breath. Certain medications, smoking, and even medical conditions affecting digestion or metabolism can also play a role. There is also something called psychological halitosis, or halitophobia. This is when a person believes they have bad breath, but nobody else can smell it. The anxiety can become overwhelming, leading to constant mouth cleaning, excessive use of mints or sprays, and social withdrawal. In such cases, reassurance and psychological support are often more helpful than dental treatments. Now, how do you know if you have bad breath? That's tricky, because we become used to our own smells. Often, the only way to know is if someone tells you, and most people are too polite to do that. A dentist can usually tell during a routine checkup. Some people use a simple home test, licking the inside of the wrist, letting it dry, and then smelling it. If it smells unpleasant, your breath likely does too. Let's talk about what actually helps. The foundation of treating bad breath is good oral hygiene. This is not about brushing harder. It's about brushing smarter and more gently. Brush your teeth at least twice a day for 2 full minutes using a fluoride toothpaste. Use a soft brush and pay attention to where the teeth meet the gums. Replace your toothbrush every 3 to 4 months. Clean between your teeth at least once a day. Floss or interdental brushes remove food and plaque that toothbrushes cannot reach. If your gums bleed at first, don't panic. This often improves within a few days. If bleeding continues, see a dentist. Now, one of the most powerful but often ignored steps, tongue cleaning. Gently clean your tongue once a day using a tongue scraper or cleaner. This helps remove bacteria that cause odor. Many studies show tongue scrapers work better than toothbrushes for this purpose. Mouthwashes can also help. Antibacterial mouthwashes containing ingredients like chlorhexidine, cetylpyridinium chloride, zinc, or chlorine dioxide can reduce odor-causing bacteria. However, avoid overuse. Some mouthwashes contain alcohol, which can dry the mouth and may not be suitable for long-term use. Chlorhexidine, while effective, can stain teeth if used too often. Chewing sugar-free gum after meals can help by increasing saliva. Saliva naturally cleans the mouth and reduces bacterial growth. Diet matters too. Limit sugary foods and drinks. Bacteria love sugar. Reduce acidic drinks like fizzy drinks and fruit juices, and don't sip them slowly. Drink water regularly. And never brush your teeth immediately after acidic foods or vomiting. Wait at least an hour to protect your enamel. If you wear dentures, clean them thoroughly every day and remove them at night. Poorly cleaned dentures are a common source of bad breath. And if you smoke, stopping is one of the best things you can do. Smoking causes dry mouth, gum disease, and persistent odor. So, when should you seek help? If bad breath doesn't improve after a few weeks of good oral care, if your gums are swollen, bleeding, or painful, if you have toothache, loose teeth, sinus pain, acid reflux, or problems with dentures, start with a dentist. If no dental cause is found, a doctor can look for medical reasons and guide further tests if needed. Here's the key takeaway. Bad breath is common, it's usually treatable, and in most cases, it's simply your body asking for better care, not something to be ashamed of. With the right habits, the right guidance, and a little patience, fresh breath is achievable. And with it comes confidence, comfort, and ease in your everyday conversations. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, Medicine Specialist, Diabetes, and Hormone Specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.